Action potentials in cardiac muscle. The action potential in a ventricular muscle fiber is about 105 millivolts. It rises from minus 85 millivolts to a slightly positive value, about positive 20 millivolts, during each beat. After the initial spike, depolarization starts and remains for 0.2 seconds, which is followed by a plateau. At the end of plateau, abrupt repolarization occurs. The initial spike, which is the starting time of depolarization, plateau, and repolarization, which will be discussed in this lesson. The presence of this plateau causes ventricular contraction to last 15 times longer in cardiac muscle than in skeletal muscle. So, we face to a question that what causes the long action potential and plateau in cardiac muscle? There are two reasons. First, in cardiac muscle, the action potential is caused by opening of two types of channels: fast sodium channel and slow calcium channel. But the action potential of skeletal muscle is caused almost entirely by the opening of fast sodium channel. Second reason is, after the onset of the action potential, the permeability of the cardiac muscle membrane for potassium ions decreases five-fold, an effect that does not occur in skeletal muscle. Phases of cardiac muscle action potential. The action potential in cardiac muscle has 5 phases. Phase 0 is depolarization. In this phase, fast sodium channels open. Phase 1 is initial repolarization. In this phase, fast sodium channels close and fast potassium channels open. Phase 2 is plateau. In this phase, calcium channels open and fast potassium channels close. Phase 3 is rapid repolarization. In this phase, calcium channels close and slow potassium channels open. Phase 4 is resting membrane potential. This averages about minus 80 to minus 90 millivolts. Phase 0 is depolarization. When the cardiac cell is stimulated and depolarizes, the membrane potential becomes more positive. Voltage-gated sodium channels or fast sodium channels open and permit sodium to rapidly flow into the cell and depolarize it. The membrane potential reaches about positive 20 millivolts before the sodium channels close. Phase 1 is initial repolarization. The sodium channels close. The cell begins to repolarize, and potassium ions leave the cell through open potassium channels. Phase 2 is plateau. A brief initial repolarization occurs, and the action potential then plateaus as a result of increased calcium ion permeability and decreased potassium ion permeability. Phase 3 is a rapid repolarization. The closure of calcium ion channels and increased potassium ion permeability, permitting potassium ions to exit the cell rapidly, ends the plateau and returns the cell membrane potential to its resting level. And phase 4 is resting membrane potential. Velocity of signal conduction in cardiac muscle. The velocity of conduction of the excitatory action potential signal along both atrial and ventricular muscle fiber is about 0.3 to 0.5 meter per second, or about 1/250th the velocity in very large nerve fibers, and about 1/10th the velocity in skeletal muscle fibers. The velocity of conduction in the specialized heart conductive system or in the Purkinje fibers is as high as 4 meters per second in most parts of the system. What is the refractory period of cardiac muscle? It is the interval of time which a normal cardiac impulse cannot re-excite an already excited area of cardiac muscle. The normal refractory period of the ventricle is 0.25 to 0.30 seconds. But the refractory period of atrial muscle is much shorter than that for the ventricles and is about 0.15 seconds.
Thank you for staying until the end. I will see you in the next video.